Hi, everyone. Today we have Dr. Wesley Ely with us. Dr. Ely is a pulmonary medicine and critical care specialist and professor at Vanderbilt University Medical Center. He is most well known for his research and advocacy work in post-intensive care syndrome, also known as PICS, and the neurological effects of long COVID-19. In 2022, he also won the Christopher Award for Literature for his book, Every Deep Drawn Breath. His biography is under this video. Welcome, Dr. Ely.
Thank you, Dr. Jen.
And so Dr. Ely, you're obviously very accomplished in the world of neurological care and rehabilitation and critical care. But for those of us who are less in tune with this topic, can you give me a brief overview of why neurological care is so important and what PICS is?
Sure. Thank you for asking. People are working in their life to have the best version of themselves, to be as productive and as happy as they can be. And when they get unexpectedly ill, unexpectedly critically ill, I become their doctor in the ICU. And what we have always focused on for the first 25 years of ICU medicine was just helping people survive. But for the second 25 years of ICU medicine, which has been my era, what we've been doing is unpacking the fact that people rapidly acquire new diseases once they come into the hospital and get sick. So if they come in with a lung or a kidney or a liver problem, when they leave, they have acquired a new brain disease and a new muscle and nerve disease, which we call PICS, post-intensive care syndrome. And it manifests itself as an acquired dementia with post-traumatic stress disorder, depression, and then muscle and nerve disability.
Yeah. And so you've really done a lot of research about this, and you've actually helped develop a method to prevent delirium PICS in the ICU called the A2F bundle, right? So can you just, I know I'm not doing it justice because there's a lot of information, there's a lot of work behind it, but can you just very briefly go through to me what it actually consists of?
Sure. And let me give your listeners a bit of a background. So in the 90s, I started seeing patients back in a post-ICU clinic, and I realized that they weren't thinking clearly and were losing their jobs and even losing their houses because they had no more income. And I started saying, what has gone wrong in their bodies? So we developed ways to measure delirium in the ICU, called the CAM-ICU. It's now translated into 45 languages, used all over the world, and then went on to prove that the amount of delirium, the number of days that you were delirious, predicted this problem of a post-ICU dementia. So then we set about, between 2005 and 2015, doing many studies, which were actually published about 35 New England Journal, JAMA, and Lancet papers, not all my own, but other people around the world as well, but many of them ours, and proved that if we could cut sedation in half, wake people up, get them out of the bed earlier, even on the ventilator, and have their family with them, that they would survive more often, that they'd have shorter time in the ICU and hospital, that they'd go home instead of to nursing homes, and have all these better clinical outcomes. So that toolbox by which we do that is called the ABC DEF bundle, these 6 steps of the alphabet, A to F, and that's why we call it the A2F bundle. And essentially what it is, I could spell out what the letters mean, but essentially what it is wake people up, take care of their pain, get them out of the bed, have them with their family, and that is the magic recipe for lifting them up in their suffering, magnifying their dignity, helping them find their why to live. And it's just been a great combination of humanism and science that now people use all over the world.
Absolutely. And I'll put a link to your website, down below so that so our listeners can actually go through, what the letters stand for from A to F. But I just want to ask you, what does the rehabilitation for PICS actually look like? What does it look like today? What is still missing, needs that should be addressed? You mentioned people should really be going home early. What else?
Yeah, good, exactly. And by the way, let me just tell them what the A to F stands for. Curiosity will drive them crazy. So A is analgesia and management of pain. B is both stopping sedation and stopping the ventilator every day. C is choosing sedatives that don't create delirium, like avoidance of propofol and benzodiazepines.
Right.
D is delirium, which is checking out if the brain works or not. It takes 20, 30 seconds to figure this out. And if it does, if the patient is delirious, we have a mnemonic that the listener might enjoy called the Dr. Dre. Dr. Dre, the famous rapper and the earbud guy. It's diseases, drug removal, and environment. That spells
Okay.
Dr. Dre, and
Yeah.
that's how we take care of delirium. And then there's E and F, and that's early mobility, getting them out of bed quicker, and even walking them on the ventilator up and down the hall. And then
Yeah.
F is family. So that's the bundle. Now, how do we rehab these people? What the first step, April, is find these people a warm handoff to their doctor. In other words, don't just let them be discharged from the ICU and 2 months later go back and see their primary care doctor who doesn't know anything about what happened to them. What we want instead is to set up ICU clinics that will see these people, understand the drugs that they need to stay on, get rid of drugs they don't need to stay on, give them physical rehabilitation, and even cognitive rehabilitation. We're using games like Sudoku, Scrabble, or computer games to exercise the brain, to rebuild the neurological connections, and it works. And these are ways that the patients refine who they are, get themselves to what is, yes, a new normal, but a much better new normal than what they would have with PICS if they got no special care after the ICU.
Yeah, so it sounds like continuity of care, which is quite a contradiction to our traditional thought process where, you know, critical care is just the acute phase and all of that. That's really interesting. And
you know,
I know
April,
that,
one day I was sitting there with a woman. She was in her early 30s. She'd come in the ICU. I'll never forget her. Lovely person, mother, young kids. And she looked at me and said, Dr. Dr. Ely, you didn't do your job, and pointed her finger straight at me. And I was so convicted. And April, I realized that I was walking around with shame and guilt in my heart because I knew that I had done things that had hurt her and had made her life worse after she left. And if I'd done it to her, I'd done it to thousands of people. And so that's what has driven me and really kept me nose to the grindstone of how to improve medicine, do the research, do the randomized trials, but also find the meaning in these people's lives. I love this Spanish phrase, cada persona es un mundo, which means each patient is a world. And so I look at them, I say, they're an entire world of a person, so complex, with loves of music and food, and there should be seen in bright color. And what we had been doing was putting people through a depersonalization chamber in the ICU, and it just wasn't good medicine. But hopefully we're waking up now to a new and better way.
Thank you so much for sharing that experience with us. I mean, one of the things that strikes me every time I talk to you is the humanism that you mentioned that always comes up again and again in our conversations. So, you know, I think it's a very important message to communicate.